10 problems women shouldn't ignore. Swelling of the breasts before your period or during pregnancy is normal, but if you have unusual or rapid swelling, or you notice discoloration like red or purple spots on your breast, these can be signs of what's called inflammatory breast cancer. This is a rare form of cancer that develops quickly. Breast infections can produce some of the same changes, so it's important to see your doctor so they can determine the cause of the changes and the appropriate treatment. Feeling winded after exertion like climbing a flight of stairs is normal, but if you find it hard to catch your breath in other circumstances or your breathing is uncomfortable, that can be caused by a tumor, blood clot, or pneumonia. It can also be a sign of stress or anxiety. Your doctor can do a physical exam and order tests to figure out the cause. Abdominal bloating in women is normal after eating a large meal or around the time of your period. However, if you feel bloated much of the time or can't eat as much as you used to without feeling full, it could be a sign of ovarian cancer or other issues. If you've started a workout regimen or are eating less and are losing weight, that's to be expected. But if you haven't changed your activity level or diet and are losing weight, that can be a sign of several health issues. They include diabetes, heart disease, celiac disease, cancer, HIV, and thyroid disease. Transient ischemic attacks, TIAs, are mini strokes that can cause these symptoms, along with muscle slackness on one side, vision problems, and trouble speaking. TIAs don't cause permanent brain injury, but approximately 30% of people who have a TIA will have a full-blown stroke later. Bleeding after intercourse between periods or after menopause can be a sign of serious health issues like endometriosis, uterine fibroids, or cancer. Having an upset stomach periodically typically isn't a sign of serious illness, but issues like abdominal pain, cramps, constipation, and diarrhea in women can be symptoms of irritable bowel syndrome, IBS, or other problems if they happen regularly. Temporary changes in the color of your stools can be caused by the foods you eat, supplements you take, iron, for example, or drugs like diarrhea medication. But stools that are black or bloody can be an indicator of conditions like hemorrhoids, inflammatory bowel disease, IBD, diverticulitis, ulcers, or cancer. New spots that don't look like the others you have, or a mole that starts changing shape or color can be a sign of skin cancer. You should have them looked at by your doctor or a dermatologist. Life circumstances can lead to temporary fatigue, but if you notice a lack of energy that recurs frequently or doesn't improve, that can be a sign of a health issue. For example, certain cancers, liver failure, depression, diabetes, thyroid disease, sleep apnea, heart disease, kidney failure, and anemia can cause chronic fatigue.